I think we're going to be moving on to taking our last question for the evening.
Yes.
So this question, it reads out, my 3-year-old son has been complaining of belly pain, and we recently noticed a firm bump in his abdomen. He also has been having frequent fevers and seems more tired than usual. Could this be neuroblastoma? How do we find out for sure?
Yeah, so we're moving on to some other cancers like neuroblastoma is a cancer of like adrenal glands. This is a cancer which happens at an early childhood, a toddler age, starting at around 1 years of age to 3-4 years. Uh, Usually, parents find a bump on the tummy, either while giving them a bath or something like that. If the child has other symptoms, important is to again get seen by a doctor, do blood work, complete blood work, as well as a metabolic panel, doing an ultrasound, identify the length or the extent of the disease involved, and the final diagnosis would happen with the biopsy of the sample. When a child comes in with abdominal mass or abdominal swelling, there is another cancer which is cancer of kidneys, which is called Wilms tumor, and neuroblastoma is a tumor of adrenal glands. They both could look similar out on the outset. Neuroblastoma patients tend to be a little bit more sicker than the Wilms tumor patients, but the way we would differentiate is by pathology. So just like many other cancers, we start with blood work, imaging, which includes either ultrasounds or CT scans. Then we do biopsy and then get a pathology final result. Once we know the result, then we would design a treatment plan. One additional step between the result and the treatment plan is identify the extent of the disease and identify what stages of cancer we're dealing with, which would determine our treatment. So neuroblastoma around the similar system we would follow. Patients who are older and have neuroblastoma tend to have higher aggressive disorder, aggressive cancer, so they would require various modalities of treatment, which starts with frequent repeated chemotherapy cycles. They get around 5 to 6 cycles of chemotherapy, followed by surgery, followed by radiation, and sometimes would require an autologous transplant as well. So the variety of treatment involved in this particular cancer. This is one of the cancer which requires multiple different modalities of treatment, and it's extremely important to diagnose early at an early stage in this, because the outcome drastically varies if you detect neuroblastoma at an early stage versus at a later stage.
Thank you so much, Doctor. And I think that brings us to the end of today's session. Thank you so much for taking the time to join us. I know it's quite late in the evening for you over there. Thank you for your insights. Thank you so much.
No, I really appreciate the time, and thank you so much for having me over. This has been really good session for me as well. If anyone has any questions, they can reach out to you guys, and I'm happy to answer any more questions if they have. Really happy to expand the information to them.
To all of the listeners, as Dr. Rikin has already said, please contact us on My American Doctor if you need consultation with any of our specialists. You can go on there, and you can also call us on 9914941494. Doctor, thank you so much. It's been an excellent session. Thank you.
We appreciate it. Thank you.
Thank you so much.